I bet you've never thought about vaccines as having their own epic story, but trust me, they do. We're about to dive into a tale that spans centuries, saves millions of lives, and honestly, is way cooler than you might expect. It all starts with a doctor, some cows, and a wild idea that changed the world forever. The practice of inoculation, known as variolation, began in China and spread to the Ottoman Empire. Ottoman doctors refined the technique, using it to protect people from smallpox by exposing them to material from smallpox sores. This method introduced to Europe, where it caught the attention of Edward Jenner. Observing the success of variolation, Jenner inspired to develop a safer and more effective method. His work with cowpox led to the creation of the first true vaccine, laying the foundation for modern immunology. Picture this, it's 1796, and smallpox is wreaking havoc across the globe. Enter Edward Jenner, a country doctor with a hunch. He'd noticed that milkmaids who caught cowpox seemed immune to smallpox. So what does he do? He takes pus from a milkmaid's cowpox lesion and scratches it into the arm of an 8-year-old boy named James Phipps. Yeah, it sounds crazy now, but stick with me. Weeks later, Jenner exposed Phipps to smallpox. And guess what? The kid didn't get sick. Fast forward to the 19th century, Louis Pasteur enters the chat, and he's about to level up the vaccine game. In 1879, this guy creates the first lab-made vaccine for chicken cholera. But that's just his warm-up act. In 1885, he develops a rabies vaccine, and let me tell you, it's a game-changer. His method of using weakened forms of the virus to create immunity, that's still the basis for many vaccines today. Now let's jump to the mid-20th century. Polio, the stuff of nightmares, paralyzing and killing thousands of kids every year. Enter Jonas Salk, the hero we needed. In 1955, after years of research, Salk announces a successful polio vaccine. The public reaction? Like if the Beatles and the moon landing happened on the same day. But here's the kicker. Salk refused to patent his vaccine. When asked who owned the patent, he famously replied, "Well, the people, I would say. There is no patent. Could you patent the sun?" Talk about a mic drop moment in medical history. As we hit the late 20th century, vaccine tech starts to look like sci-fi. Scientists figure out how to use recombinant DNA technology to make vaccines. It's like they're hacking the code of life itself. This tech leads to vaccines for things like hepatitis B and HPV, human papillomavirus. And get this, the HPV vaccine doesn't just prevent an infection, it prevents cancer. That's right, we've got a shot that stops cancer before it even starts. Now let's talk about the new kid on the block, mRNA vaccines. These bad boys made their grand entrance during the COVID-19 pandemic, and they changed the game overnight. Instead of using a weakened virus, mRNA vaccines use a piece of genetic code to teach our cells how to make a protein that triggers an immune response. The best part? We can make these vaccines super fast. What used to take years now takes months. It's like we've upgraded from a dial-up internet to 5G in the vaccine world. And the potential doesn't stop with COVID. We're talking possible vaccines for HIV, malaria, and even personalized cancer vaccines. Here's something you might not have thought about. Vaccines are kind of like fine wine. They need the right storage conditions. Most vaccines need to be kept cool, and some need to be super cold. We're talking minus 70 degrees Celsius for some mRNA vaccines. That's colder than Antarctica. This need for cold storage is why you hear about the cold chain in vaccine distribution. It's a high-stakes relay race to keep vaccines at the right temperature from the lab all the way to your arm. One break in the chain and poof, those precious vaccines could be ruined. In the US, we have the Vaccine Adverse Event Reporting System, VAERS, to track any possible side effects. It's like a safety net that catches even the rarest of reactions. Let's zoom out and look at the big picture. Vaccines have literally changed the face of global health. Smallpox, eradicated. Polio, nearly gone. Measles deaths, down by 73% worldwide between 2000 and 2018. We're talking millions of lives saved here. And it's not just about preventing deaths. Vaccines help kids stay in school, adults stay at work, and generally keep societies healthier and more productive. It's like a domino effect of positive outcomes. So, what's next in the vaccine world? Buckle up because it's exciting. We're talking about universal flu vaccines that could protect against all strains. Researchers are working on vaccines for HIV, malaria, and even Alzheimer's. And with new technologies like CRISPR, who knows what might be possible? Imagine vaccines in pill form, or patches that don't need refrigeration. The possibilities are mind-blowing. From Jenner's cowpox experiment to mRNA breakthroughs, vaccines have come a long way. Until next time, be in good health.